Hello everyone, I'm Dr. Shivahat Ali. I'm consultant cardiologist. So today I'll be discussing a very important topic, I must say. And in daily life, especially if uh, you are dealing with cardiac patients, or if someone is advised with echocardiography, they will ask you these questions that why it was advised to have echocardiography, what's benefit of it, and what will you look in that echocardiography. Echocardiography for a common man, I will just say it's like an ultrasound of our heart. Okay, so I'll discuss what will we find in this echocardiography, like what will we try to examine, and how it will help us in those patients. So first of all, I would like to say you that kindly subscribe my channel, as well as click on bell icon, and if you will like my video, kindly like it as well. I'll try to make videos not only regarding to cardio related topics, but as well as like for other topics as well, so that I want to educate my community, not in terms of like I don't want to guide them just speaking bookish terminologies. Like I'll try to speak in their language and common language so that they can understand and absorb knowledge, I must say. So let's start with it. So what is echocardiography? Echocardiography is, as I told you before, like it's an ultrasound of our heart. So to who we advise? So first of all, like we usually categorize those patients. Uh, Sometimes it will be advising children as well, because if a doctor is noting some kind of growth abnormality, or during a clinical examination, or especially at birth, if or during abnormality scan, anomaly scan, if your doctor is mentioning something regarding heart or chambers of heart, so after birth, it should be, a child should go on through that, because it's a very good non-invasive investigation. But obviously in child it's very difficult as well, but still it's non-invasive, and it will not harm to your child. So what will we look in child? I'll tell you, like when we'll discuss everything in detail afterwards. So any cardiac patient who has gone through any who had history of heart attack, any congenital abnormality, as well as who has gone through bypass, angioplasty, stenting, anything, valvular replacement, we will advise for baseline echocardiography, as well as whenever he or she is following us, we will go not like the monthly basis, but at least 3 monthly or like 6 monthly in those patients. Ideally, should be echocardiography should be performed. So also to who we will advise echocardiography, if someone is having cardio-related symptoms, like if someone is having any chest pain, chest discomfort, any pain radiation towards left arm, any difficulty or shortness of breathing, as well as any irregular heartbeat, or if someone is having a stroke, his recently or previous history as well. Also, like I would say, for screening purpose, especially if someone is having uncontrolled hypertension, he or she should still go with echocardiography as well. I'll tell you later on that what will be the benefit for in those patients, as well as like in diabetic patient, if they are above 50 and uncontrolled diabetes, you should have echocardiography as well as baseline, because sometimes symptoms are really very silent in those patients, so you should not ignore those, and at least you should go with echocardiography as well, because it will give us a very good overview picture of your heart. Also, like in pregnant ladies, especially in the later weeks, or last term, I would say sometime, especially if they are having symptoms of shortness of breath, because sometimes we may diagnose with them postpartum cardiomyopathy. Postpartum doesn't mean that it will start after delivery. It can be, it can start appearing in last month of your pregnancy as well, so don't ignore this. So also I would say, like if someone is going for major surgery and he or she is having comorbidities, we will advise with echocardiography as well. Also, if he is in that age category, so for preventive measures we will also advise with echocardiography, because in post-op care it's very important, because sometimes you may need to give IV fluids, IV you know I must say nutrition. Also, like you may need like to give a transfusion as well. So we should have uh, your baseline echocardiography in those patients as well. So what will echocardiography tell us? The most important thing, it will give us a very good overview of your any segmental wall motion abnormality. What is segmental wall motion abnormality? Means like an artery is related to your wall. If there is any prominent obstruction or any kind of obstruction, it may lead to any abnormality of your valve movement of your heart, right? So as a cardiologist, we divide valves into various segments as well. So if a related artery is having some kind of problem, it may lead to show you any segment of wall motion abnormality, like your wall may not be moving properly, it will be moving less, or it will be like at totally a aphasic phase as well, like it will not be moving. It will also tell us about pericardium, or any fluid around your heart, or any if some fluid, no doubt a bit of fluid is present in your area around of your heart, but if it's above normal limit, it will start to put pressure on your heart, and obviously in your pumping power, which will lead to decrease in ejection fraction, and it will ultimately lead to your heart failure, to in heart failure category as well, and it will start to give you symptoms related to heart failure, like shortness of breath and others. So also very important thing in child, like any developmental abnormality, like any chamber developmental abnormality, or any fusional abnormality of like walls are not properly formed, echocardiography will show you. So if any vessels abnormality present since birth, it will also tell you in children. Also another thing is which is mostly ignored, especially when you are not going echocardiography with cardiologist, is diastolic dysfunction, because it is also important as your systolic function, which is telling us about your ejection fraction. Sometimes like patient is having heart failure symptoms, but the ejection fraction is totally fine, but when you are looking into their echocardiography report, no one has mentioned any diastolic dysfunction. Sometimes patient may have diastolic, sometimes patient may have symptoms uh, similar like of heart failure in if there is a normal ejection fraction. Why? Because their diastolic dysfunction is present. So don't ignore this, especially in patients with kidney diseases. Do mention diastolic dysfunction in your echocardiography report, because it is very important. And if you, because management is almost same, with systolic heart failure or diastolic heart failure. So you should also don't ignore this. So a very very important parameter which we will look for is your valves. What is valve? Like in our region, mostly people, as I was mentioning in my Urdu video, like people usually say one valve closure, two valve closure. They are relating to arteries, which is mostly viewed by coronary angiography or CT angio, but not, we don't look those arteries in echocardiography. It is usually walls are like windows or doors in between your heart chambers, so it should not be in tight category, or it should not show any stenosis or when a heart pumps, one blood moves from one chamber to another chamber, so these are like window or door. Ideally this should not be tight or this should not be loose, so that your blood should go properly in forward direction, and it should not, if it's in relaxed phase, so it will start to regurgitate into your backward direction as well, and it will lead to enlargement of your heart chamber, or then ultimately leading to any irregularity in your heart rate, or any irregularity in your heartbeat. So not only stenosis or regurgitation, any congenital abnormalities, or any patient with history of rheumatic diseases or rheumatic fever, we will also go with echocardiography as well. Also, if someone is having fever of unknown origin and you are not finding any diagnosis with that, you should go with echocardiography, because sometimes valvular involvement is there, and you may need treatment for that. Also, as I mentioned before, that for in patient with stroke, it is very important, because sometimes there is clot, mostly in LV region, left ventricular region, which is the most important chamber of your heart, as well as sometimes valvular involvement is there in causative factor of your heart. So stenosis regurgitation, as well as you may be having any clot from your walls as well, leading to your stroke, so we may need correction for that, so that we may prevent further episodes of stroke. So also, as I was mentioning before, that if you are having uncontrolled hypertension, you should also go with echocardiography as well, because it will tell us if you or are having any kind of hypertrophy or not. Sometimes it's minimal or trace, you may need you don't need any treatment for that, but if it's going in moderate or severe category, you may think for treatment, and you should also take caution for advising some medications as well. We will discuss that in further videos, if I'll make videos regarding treatment, I'll try to make those. So in daily routine for cardiac patients, it's very very important, because sometimes uh, you may need their management, or you may someone is coming with a new exacerbation of symptoms of heart failure, or anything of shortness of breath or any chest pressure. You will not be advising again and again angiography or CT angio. You should be performing at least echocardiography before, and that's why it's very important, especially in those patients who are on regular follow-up with you, who are diagnosed or who has gone through their cardiac related treatment. So I hope this will help you. I'll try to make more videos as well. So kindly like my videos, share it with your other friends and family to educate them, and kindly like my channel and subscribe it. Take care. Bye bye.